is coming up. One of our housekeeping items here is we are starting a new series for our members as well as our general population who've attended an awful lot of these. You've seen these gentlemen before. This is Dan Mateo and John Rizzo, and they are our financial experts. This has become a business line for Inspire Care 360, and we have partnered with RDG and Partners. They are extremely well equipped for the ECE Childcare Montessori schools throughout the nation in supporting financial knowledge and development there. What we've had is such a strong response to the CARES Act and the PPP information over the past almost 12 months now, that by high demand, we created a 9-series webinar that will be starting on March 30th. So please mark your calendar. I know that we will be getting out a save the date for everybody very soon. And these gentlemen and myself will be talking about specific relevant issues. We will have a theme topic for every month, but with that theme, we're really going to be talking about too, what is going on. So for instance, with this one coming up in March, not only are we going to be talking about a theme that addresses some elements of healthcare benefits and the values of it, as well as the drawbacks and the tax elements, but the $1.9 trillion act that was passed and now needs to pass Congress, that will also be addressed and how that could possibly affect your business. All right. But what we will typically do in these is we are going to look to talk about the financial elements of your business. We're going to talk about different key performance indicators, anywhere from what your payroll is to your ratios to your enrollment revenue, to looking at your expense lines, to how you should be looking at capital expenses. But we're going to break it down. This is not going to be accounting talk. I don't do so good with accounting talk, but what I do is I advocate for you too on this call. In addition to your questions, I will be asking questions because I own and operate centers myself, and I want to understand how it impacts us. So we really have an opportunity to talk to these guys who are very open. They will be talking about different elements about desires to acquire more centers or eventually a succession for yourself, whether you're looking to sell to the public or maybe move something to a family member, things of that nature. So we are going to talk a lot about these different elements. We're going to talk about elements associated with a lot of the things that came out of the CARES Act, as well as other things that are available for looking at tax forward as well as tax back for a couple of years. And so there's a lot of opportunity for you guys, and we've put together this 9-series business benchmarking series for you folks, and hopefully you guys get a lot out of it. Any kind of questions too that you want to get answered, we'll be soliciting them ahead of time. So with that said, let's move forward, and we are going to start with a poll question. So I'm going to ask everybody I'm going to launch this poll. What interests you the most about healthcare plans for your schools? Are you looking for more affordable options? Is it just right to offer healthcare to the staff? Is there needs to offer greater flexibility in different types of healthcare? Okay. Do you have a need to meet the Affordable Care Act and avoid any kind of massive penalties and fines? And so let me give you guys a couple minutes. We see a number of people coming in. We already have about 65% who've reported in. And I'm not going to be surprised at all when I see these answers, because I can see them tallying up right now. But there is one in every category at least. And I'm going to close out the poll in about 5 seconds here. So there's only a couple more people who want to answer. All right. Well, let's go ahead and look at the answer. And I'm going to share the result with you. What interests you the most? More affordable options. Straight up, 64%. That's not surprising at all. When I got into owning my own and operating my own centers back about 10 years ago, one of the very first things I did is I looked into healthcare options and just going, this is crazy. Huge high deductibles, big premiums. The expense to the ownership was huge. The expense to the staff member was huge. It was sort of untenable. When we did put in major medical plans too, we noticed that most of our staff was healthy. And I would ask at the end of the year, I said, how much were you able to use the plan? And most of the time, everybody said, I wasn't even able to use it. I just paid premiums and I have a high deductible. So I really avoided going because I really didn't have any major issues because most of the staff was very healthy. There were obviously occasions that some didn't, but that's very helpful. Obviously, it's just right for the staff. Obviously, a great values answer, but looking at different offers, different options, and whether we want to admit it or not, now, especially with the new administration, the Affordable Care Act is going to become roaring back. So with that said, thank you very much for answering that poll, and let's get along with the presentation. We hear a lot about culture and developing culture and what's the secret to culture and all those things. There are some pillars behind a successful culture in a center. And why do we talk about a culture? We talk about a culture because a culture is really the underpinning of how you have the right kind of offering to your families to have basically the environment that meets and exceeds the values that you have, your staff had, and your family seek. So culture involves offering staff in this situation wages, different benefits, the fact that they belong to something, respect, their self-value, opportunity. Those managed with leadership is creating your culture in your center. When you look at healthcare benefits, it is really a key element. If we looked at, and we talk about, people hear me say all the time with Maslow's hierarchy of needs, one key element is healthcare. It's not just having benefits of having childcare as a benefit. We can offer childcare services, and we do. Most all of us do. It's a great benefit. But we have extra space and time. We have the ability to do that relatively easy. What we don't have the way to do easy is healthcare benefits. So over the past couple of years, we really thought a lot about this. We looked at what is a way for us to really look at what we see our why, and that is what really can support our schools. And when I mean our schools, I'm not just talking about my schools, all of us here, everybody who's on the call, our school's success and offering a solution that can really help develop our children that we take care of. What can we do to really stabilize our teacher base and get away from the revolving door? And trust me, with the solutions that we've put in, even though we've really reduced our turnover and we've really increased our retention, we still have the challenges, and we will continue to have those. But we continue to work on stabilizing. And if we can stabilize that base, we really believe that a positive culture can come in place because you're recruiting and you're retaining. And we also recognize that culture is definitely more than wages, that you have to have your staff feel like they belong to something. And today we're talking about the benefits portion of it. So with that, just a few little statistics just to get us focused. And that is 68% of all for-profit childcare organizations ranked labor as their top issue. I don't think any of us are surprised at that. I was actually a little surprised when we were going through the lockdown. I thought for sure coming out of the lockdown, it was going to be enrollments, that we all needed to focus on enrollments to get back up to speed again. Enrollments for some of us is not there yet. For others, it's already there. It's already back to a wait list. But the one thing I've heard from everybody is participation from labor, that they don't have the right labor in place and they're looking to retain the right labor. 65% ranked talent and recruitment as their top priority. And the cost, even though if you're replacing someone from $10 to $13 an hour, actually can be anywhere from $10,000 to $12,000 a year. That's a bottom line dollar that you look at what your investment up top is in recruiting and retention. On the bottom line, when you have someone turnover, you're like, well, it doesn't seem like it's a lot. Well, actually it is, through all of the training and the development, all the time that you spend from your mentors and your directors, the hiring, the process, the ads, the Indeed, all that stuff. But then on top of that, you think about, you may lose families because you lost a staff member. You may lose other staff because you lost a staff member, as what it says about your organization. So those are very real kind of numbers. Also an element that we are really well in, right now, we're well full of the millennial generation as our labor pool. The studies are in it, to capture and retain younger employees, touting your culture is more important. It's more important than wages, and it's more important than benefits alone. It's really about developing that as a culture. But as I showed you earlier, it's really about a number of things associated with your culture. So we look at benefits from how we present benefits. We're posting them in jobs. That's where it actually adds a lot of value to us to recruit people, to say that we actually offer healthcare benefits. And so that recruiting process, going through the interviewing process, and be able to say is, oh, by the way, here's our 5 different programs. And by the way, would you like a dental program or a maternity program or these others? These are all options to you. Then an onboarding experience, when you actually have gone and hired the individual and brought them on, having a very positive experience and how they experience benefit onboarding. And not one of these things where I thought you guys had benefits when you did the interviews. I saw it in the job posting, but no one's talking to me about it and no one's really sure what to do. That is something that is consistent with a lot of centers. And then obviously going through your career, as we know, our teachers, especially the good ones, get calls from the public school district. They get calls from other employers, and they get picked off oftentimes the most easy because of healthcare benefits. And they're looking and going, I only have a wage here. I really do not have a healthcare benefit that meets what I'm looking for. So we're going to talk about that today. So what is IC360 ECE Healthy Advantage? And the reason we named it Healthy Advantage was because we really wanted to focus on the fact that the population that we are mainly addressing, even though this works for everybody in a center, it works from ownership to your bus driver and everybody in between, but really your teachers, the bulk of it, and your administrators don't oftentimes have a very solid solution. Your teacher base is oftentimes between the ages of 22 and 35, some a little older, some a few younger. And then your administrative base is oftentimes about 35 years of age up to about 50 or so. And in the demographics there, well, your teacher base is your greatest part of your population. They are also sitting in a demographic that's a very healthy demographic overall in general. So for them to pay out of pocket a tremendous amount without getting a return for it is very difficult for what major medical offers. But these are built specific. So over the past 2 years, I've worked on these programs. We've worked on these and we've defined programs that can work specifically for the ECE industry. These are flexible options. So there's not just one program. They go, you take it or you leave it. There's a lot of flexibility to this. We've negotiated the program. So you might be able to say as well, it'd be great, that I find out exactly who they're using. I could go make my own relationship. Please try if it works for you. But the fact is, we have hundreds of member locations throughout the nation, and that gives IC360 buying power. We're the only ones who really do what we do specifically to be an extension of your business and to be on the forefront of trying to negotiate deals like this on your behalf. And we believe that the offering too that we're bringing with this, we paired up a benefit administration, which we're going to talk about later, but the administration part is a key component. I know with my schools, when I had my original 6 schools when I started, it was honestly a logistical nightmare to try to have an enrollment process for a number of our staff, and not even everybody, but to get them the paperwork through new hire over to payroll, make sure everything was right, having my team work on it. That was like a full-time employee for me. And that was a huge expense. We have a solution for that built into this program. And hopefully you see Inspire Care 360 as a trusted partner. So we are working with USI. USI is a $2 billion national broker. And what they do is, Inspire Care 360 is bringing this to the marketplace. And USI is the broker who is facilitating the relationship. So what that means is, at the end of the day, Inspire Care 360 will give you all the information, tell you all about it, work with this program. And then if you decide you want to come on board, we still facilitate it all, but USI is the one who actually incepts it for you. Okay. And there's no additional cost for them as a broker or anything of that nature. They've just been our partner in building this up over the past couple of years. So there is a lot of flexibility. What you're going to see is 5 medical plans. You're going to see 5 voluntary plans. You're also going to see the benefit administration that's going to help you with the rollout, the value that there's a platform, for all of your staff to have it managed for them so they know where to go to look at their benefits anytime, day or night, right over a smart device. And then there's management support to help you with any questions you have ongoing about the benefit offering. Whether you do it and set up your company at any time through the year, you can set up your company to start initially. There will be a one time of year open enrollment program, but then for qualified events, people can change benefits if they went through a divorce or if they lost a loved one or things of that nature. And we'll talk more about that too. So let's go into the options. So there are 5 programs. We're going to start with what we believe is really one of the top programs, and that is the Ultimate program. These are the programs that your employees, your staff see. And so they're going to see these different levels, and then we will talk after this about what the employer pays for these programs. So what you see here is in the Ultimate program that it's about, if they're using it, office visits, specialist visits, $15. $50 urgent care, x-rays, lab work. There's a full telemedicine program working with doctors nationwide. But unlike the major medical ones where you pay anywhere from $45 to $70 or $80 for a telemedicine visit, this is zero, no additional cost. It all comes with it. And medications anywhere from $10 to $75 with the program. The best part about this is all from $1. So there is no high deductible program. This works from the very first dollar. This is covered by most doctors' offices, and we actually do a census with you ahead of time to ensure in your region that you have plenty of coverage. This program, the way we've set it up, it is something that goes throughout the US. There may be 1 or 2 small spots out in the West, but for the most part, it's strong coverage throughout the US. No deductible again, and employees pay a portion as well as from anywhere for this program at $30 for a single program, a paycheck up to $90 for an entire family. And when you think about the costs associated with it, and we're going to do a cost sheet here too, so you're going to see this again. You'll see that this is super competitive. These prices are way under the rates of major medical. So let's talk about the Ultra plan. The Ultra plan, these all plans are going to back off a little bit, right? So $15 office visits, you don't see the specialist here. You see the $50 urgent care and behavioral, you still see the telemedicine, and you see specialist discounts. And then you see, again, 100% coverage for anything preventative, no deductibles. And then you see what the cost is to the employees. It's obviously going to start dropping per paycheck a bit. So it becomes more affordable, but it still covers a number of elements. The virtual program, you see where it backs off a few other elements again, and it comes down to $15 per paycheck for employee, or $45 for an entire family. And there's also programs for a family, a parent plus 1 child, a parent plus a spouse only, or a family. So we do have those options built in. Then you have the most basic plan, which has all the preventative still, no deductible, full telemedicine program in network. So this is if someone really is like, I'm healthy, I really don't need a plan. You know, they're impervious, they'll never get injured, they'll never die, none of those kind of things. Well, it's $11.50 per paycheck. That is so nominal for what they actually receive from this program, because the preventative care is all their physicals, it's their mammograms, it's their cancer screenings, it's the different type of things that they very well will encounter. And then on top of it, there is the 5th option, which is a telemedicine only program. This is not something where the employees pay a premium. The employer does pay for the program at $10 per employee, but there is no premium. This is something that I've actually offered all of my staff as a safety net. So I give this to all of them. They do have 24/7 access to doctors. They're all United States doctors in the US, and it's very helpful. I know that one of my staff members today with Inspired Care 360, Jen Guadiosa, who is supposed to be on this call with me presenting, because she does this much better than I do. Jen actually is out with bronchitis right now. And so Jen just used their telemedicine service because in addition to other healthcare, the telemedicine is so easy, getting immediate access to the medications you need at your local CVS or Rite Aid or wherever. So again, as a reminder, no deductibles. These are paid from $1 options. All the preventative cares, whether they have a child on the program, from all the different types of screenings and assessments, this all comes with no additional charge for all the programs minus the telemedicine, or the routine screenings, again, for physicals, blood pressure, mammograms, all the different elements that all come with. So this is something that 100% covered. Now, let's talk about the ancillary programs, additional flexibility options. So there is a dental and vision program that covers a range of different costs. And this program can be out of pocket anywhere from a single of $15 up to $40 a month, not per paycheck, a month, that covers and gives you, for both dental and vision, gives you a very nice reimbursement. We have a custom-made maternity program. If you think about who our audience mainly is, it is mainly young women between the ages of 22 and 35, definitely in childbearing years and definitely interested oftentimes in starting families. We have a specific program for that. That program covers two elements of maternity. One is the cost of medical expenses at the hospital, but there's also the cost of time at the office that's missed. So there's an additional disability cost in addition to the medical costs. Now, this is a fixed rate for the maternity program that can be determined ahead of time. And depending on how much reimbursement a staff member or anybody who would like to take advantage of this program would like, and it may be an owner, it may be an administrator, what have you, they can invest in this program. There is a 9-month waiting period for the obvious reason, since this is insurance, they don't want anybody coming in who's already pregnant, who's then looking to get into a maternity program. As insurance tends to work, they're looking for payments in before they pay out. So there is a critical illness element of this. This is for anybody who really wants that safety net, looking at any kind of illness that may affect them that goes above and beyond. These healthcare plans that we've talked about, the ultimate down to the basic, which you saw on the other page, do not include a hospitalization program, all right? But the pairing them up with these type of elements gives you that option. So there is a difference between this and major medical. Where major medical, you do your $6,000 deductible, you pay your premiums. After you pay your $6,000, you then have an opportunity to get reimbursed for any of the different type of programs you go for, okay? So with that said, this program is different. Those office visits are all covered, you see, but hospitalization is not covered unless they select one of these different types of programs, like maternity, like critical illness, or hospital indemnity, which gives a real nice support if someone does go to the hospital. And again, you see these are prices per month for a single individual. So you can pair a few of these together along with the other ones and actually build a rather nice program together. Accident recovery too. And we're looking at offering for those states who do not have a state mandated disability, that there will be a disability program. So with that said, before I go forward, Leah, do we have any questions out there? And you may have to take off your mute.
Yes, we do. I just put it right in your chat for you.
Okay, let's take a look here. Let's see here. Are these insurance programs only for centers with employees? I am a licensed home daycare provider. I am the owner and the only one that is available for this. Okay, so that's a great question. That is a great question. The challenge is, so these are insurance programs that are based on a number of employees. What we've done to make these programs work is we have had to create a minimum. So there is a minimum number of employees that you need to be on this program to take advantage of it. You need to have 10 employees or more to take advantage of one of these programs here. It could be any one of these, but you need to have 10 or more. If you don't have 10, you can do what they call as an owner, and you'll see where the pricing is you can pay for a ghost life. And what a ghost life is where you don't have enough employees. Let's say you have 8 employees. You would have to pay the equivalency of the employer cost for another 2 of them. And we'll talk about the employer cost in just a second. So we're going to move forward, and hopefully that answers your question. And is there any cost to the center? Yes, there definitely is. And we're going to talk about what that is in a minute, because these are also called minimum employer contribution plans. So we will talk about that in just a couple moments. Good questions, though. Let's move forward here. So here we are with pricing. Now this eye chart, just give it a second to soak in. All right. I'm going to sort of describe what you're seeing here because there's a lot of information. On the left-hand side, we're looking at what are the solutions: an owner premium program, non-member, minimum number of employees, the monthly rates, employee plus spouse, children, family deductibles, and then what are the benefit summaries that they get. Across the top, you have, here's the telemed program, here's the basic, here's the virtual, here's the ultra, here's the ultimate program. Now, what we have here is an example, which we're going to actually go through first. This is if you had a typical major medical program, and after this, we're going to go through a worksheet too. So a typical program for an owner premium for major medical, and we know that as we get these rates already go up. Even, and this is based on a Blue Cross Blue Shield program. It could be different anywhere in the country, but this is for a bronze program I have at one of my centers. And this has a $6,000 deductible. Okay, as the owner, I pay $155 for that program because I pay for half of that. And these programs have recently increased again in their costs. So this is probably light. If I was to pay for a family, I'd be paying, as the owner, $515 a month. You know, number of employees vary per state. Your state might be 0, your state might be 10. Okay, every state is different. The employee cost for this program only, this is just an example again, for that employee would be $155 or $360 as their premium, or $360 again a month if they had a child, or their entire family, $721. And again, none of this, they're paying these premiums and they don't get $1 other than preventative care unless they pay their $6,000 deductible first. The coverage, though, for preventative care is still 100%, just like our plans. They do have a cost for telemedicine, and it's an expensive cost per usage. Our plans are at 0 copay. Once you satisfy this $6,000 deductible, then you would have 100% coverage of many of the different programs that we have, including different hospitalization elements. You also have access to different formularies of different drugs. And I know just because I still have a major medical program myself, and I know just from going to CVS, oftentimes, because you have a formulary with Blue Cross Blue Shield, it does not mean you have the lowest price. If you go on to GoodRx or one of those things, you oftentimes can get something much lower. Or if you have it like with our program here, where we have built-in fixed rate discounts. Okay, and so this is what a typical major medical looks like. So let's go to the telemedicine again. If you're to do the telemedicine only, that's where the employer pays $10. There is a 20 employee minimum for telemedicine only. This is not any of these programs, just telemedicine only. The employee pays nothing for it. There is no deductibles, and they have a healthcare discount card. This does not meet the requirements for the Affordable Care Act. What it does do, though, it does the right thing in the sense of offering all your staff an option. The telemedicine is a great program only in the sense that, I shouldn't say only, but in the sense that if you have staff members, instead of them taking an entire day off, they can literally pop into another room and go through a visit with a doctor instead of taking half a day off, so you guys can stay more in ratio. There's a lot of options of how a telemedicine can benefit. A lot of things exhibit themselves at nighttime. It gives them an option to talk to a doctor at any time, day or night. A number of you have started to use telemedicine, know how easy it is and how straightforward, but this one is super inexpensive. Then we have, again, between the basic plans all the way to the virtual. So one of the persons asked her, is there a cost for the employer? And yes, there is. So just what we have is for your first 10 employees, this is for the member rate. The first 10 employees is $50 for your first 10 employees. For each additional one, it's $25 after that. So that's 11 employees or above who are on the program. So your first 10, you are paying a minimum basically of $500 to have this entire program for the first 10 or up to 10 employees. And then $25 for each additional employee. But here's the interesting part. It doesn't matter what program they choose. So whether they choose the basic, the virtual, the ultra, or the ultimate, whether they choose a program that is for an employee or family, so from here all the way down to here, you as the owner still pay the exact same amount. So you, unlike a major medical program where you could be on the hook for a lot of money, $515 a month for a family program, or even more, depending on how much you pay for it. Here you have a fixed expense. Can you pay for the employee's premium? You sure can. You absolutely can. But this is what we call your minimum employer contribution. This was one of the things that was negotiated so we can have this program, that the employer had to pay a certain amount of the premium. And then for your employees, these are the rates that we just talked about. So anywhere from $11.50 or $45 a month for an employee up to about $30 a month to get all these different types of benefits. Okay. Again, no deductibles on any of these. 100% of preventative is covered. And there is a 10 minimum here for the basic programs. I see a few different questions coming in, so I'm going to just take a moment to see if I can answer some of these questions. All right. Where can we see provider networks? Will the broker do a distribution analysis for us? Is there out-of-network coverage? So there is a defined network for this program. And yes, we will do a census with you. If this is something you're interested in doing, Andrea, this is where you come and say, yes, I'm interested. And we give you finer detail with the broker. They come in, they look at where everybody lives, and they will do a distribution to show where your network coverage is. All right. Does the employee need to work full-time? Do part-time employees or subs qualify? That's a great question. The way that we have set this up is if an employee works 20 hours or more a week on average, they can partake for this. Now, you can have someone who is less than that. If you want to have someone who maybe is coming in for a period of time, for a floater, let's say, or a sub, like you said, that comes in for a period of time during the day. However, you have to recognize that they are paying that money as a premium out of their paycheck. And if their paycheck's not that big, it may compromise their whole paycheck. So you just want to be thoughtful. In some situations, that's enough. And, or if you want to pay for theirs as an incentive, because maybe you need openers and closers and you're dying for openers and closers and you don't mind paying a split shift if your state requires it, you may not mind paying for that person who comes in the mornings and comes in at the evenings to help you do that, to get them a healthcare plan and recognize that you want to pay for some of their premium. The employer pays a minimum of $500 per month for up to 10 employees. That's the next question by Deanna. Yes, Deanna, $50 per employee for the first 10 is a minimum of $500. If you go to 11, then it's $525. $550, you go to 12. So yes, to answer your question. How about specialists? So yes, most specialists are part of the program. What this is part of what's called a multi-plan program. Most of your providers, your primary care providers and specialists, they take your major medical, whether you're like Kaiser, United, or Blue Cross Blue Shield, or any of the major ones, but they have also a set of what falls into what's called multi-plan providers. And this program fits into the multi-plan provider. To date, since last summer, since we rolled this out, we have not had one of our members come back to us and say, we don't have coverage, because we do the upfront diligence on the census. So someone else asked again, what does the 50-25? And just as a reminder again, whether the 50 is what the employer pays monthly for the first 10. After that, it's $25. If you'd like more information, we could talk about it. Is the employee price listed a monthly price? It is. So these prices here are monthly prices for the employee, what they would pay. Okay. So if you broke this down to a weekly paycheck, that's where we get like the $11.50 or a weekly paycheck out here. Of course, if they get paid biweekly, double that up. If they get paid monthly for some reason, which not many do in here, this is what be the max amount they pay. And again, an employer can pay that premium for the employee if they so desire. Okay, if our state requires we pay 50% of the single rate, will we still meet the need to pay more than 50-25 to meet the requirement? This would be specific that we would ask USI, our broker. We have not found that circumstance where this does not meet, because it's supposed to meet in all 50 states. But Shauna, I do not want to go out on a limb and say for sure, because we are talking about healthcare programs. We're talking about how they do ebb and flow. So what I would recommend is that we get your question to Jen and John, who is our broker, and we get that answered for you. Okay. There's a 9-month waiting period for maternity coverage. What about the other benefits? There is no waiting period typically for the other programs, depending. Again, the dental and vision, you have a term that you have to hold the program for. So you can get the dental and vision right away, start using it right away, but then you are going to have to hold that program. You can't then go ahead and cancel it as soon as you use the benefit. So some of those programs have elements around that for the voluntary programs, but it's a really good question. Again, this is about insurance. And what that means is insurance companies, unfortunately, like to make money. And because we're presenting this, doesn't mean that I believe in the high cost of insurance. But what it does mean is we're trying to find the best way, the best avenues to navigate through this for all of us. So thank you, Tasha, for asking that question. All right, I'm going to keep on going. And as you guys have more questions, I'm going to try to stop and answer them again. Remember, again, if they're in the Q&A, we'll look at them. And if you need to use the chat to ask a question of Leah. Say, hey, you know what, I'm interested. Here's my email, here's my phone number, whatever. And just chat it up there, and we'll be sure to get a hold of you. So down here, there are some additional fees. All right, there is a setup fee. We do have a setup fee because we're doing a lot of work on the front end to get this set up. We're really trying to make sure everything happens to get not only the census data done and not only all the information in and processed, but then we're getting our benefit liaisons to come in. And so there's a lot of setup. There's a one-time $350 setup fee for a member. And there's a non-member $475 fee. So we have down up here top non-member owner premiums. If you are not a member, you would have these premiums monthly. So instead of 50, you're paying 60. Instead of 25, you're paying 35. So there's obviously a privilege to having a membership with us. And that's it's substantial. It's $1,200 a year difference per, for your first 10 employees. Plus you have to pay down here as a non-member $475 setup fee and an additional monthly platform fee for the $295. Since this program dovetails into the Inspire Care 360 membership, we are able to cover some of that platform under there. So there's no additional platform fee or administration fee because of you having a membership with us. There is a cost for having additional locations. Well, why would you charge for additional locations? Well, the reason is because it is a different setup for different locations. Now, I will say that we have a special program for school-age locations that may be located in elements like in a school where you don't have your own standalone centers and your entire staff, but you only have a few people. But you can ask that question to us offline. Okay. And the cost, what is the cost of membership, Shauna asked? Great question. Depending on the number of locations. So the Inspire Care 360 membership is a highly dynamic membership. We have a number of members on here. We have a few non-members on here. And I would say that I can spend some time, because obviously I'm very passionate about our membership and all the things we do for you. Shauna, what I would suggest, or anybody out there who's interested in the membership, I would suggest that you reach out and say, let me find out a little bit more about that. And then depending on your school size, if it's one location, if it's multiple locations, there is different program rates for you. So it can be anywhere from, you know, a program rate of under $500 a month, all the way up to $1,000 just for one location, depending on the level of service you want. But there's a varying cost with that. So thank you, Sean, for that question. All right, and we're going to move forward for everybody. All right, so let's use this. Let's go through a quick exercise. Major medical. This is something that I did because this is exactly what I had in my schools. 6 staff members, premiums of $375 per staff member for their costs. High deductible programs, $6,000 before any coverage. So they're paying the premiums, but they're not getting any coverage really other than preventative, except until they pay $6,000. And honestly, I would come to my staff and ask them again. I'd ask them all the time, and they'd say, no, we're all set. So then employee premium per year is, if we took half of this, 375, 187, we have their premiums that they're paying for 12 months is $2,240 per year. That's what an individual is paying. An individual employee is paying for the premium only without any of the deductibles. The employer themselves, if it's at 187 times 12 at 6 employees, they're paying $13,464 for those 6 employees. All right. This does not include the cost of administrating a benefit enrollment, the management of benefits throughout the years, the payroll reporting. All that stuff is add-on, almost bring on another headcount cost to this, or a partial headcount cost just to manage that. So your total cost is $13,464 with administrative costs. This is exactly how I had mine set up before. It covered 6 of my staff. It didn't meet the Affordable Care Act requirement, because though I was offering this, I was dancing at 48 to 52 full-time equivalents. So let's talk about, for 1 second before we go forward, we're going to talk about the Affordable Care Act for 1 second. The Affordable Care Act, or Obamacare, was implemented about 6 years ago, and it was meant that everybody has health care in the country, and it was meant that basically insisting that all employees must buy into a healthcare program. And if you buy into that healthcare program, then we'll charge that program back by minimums to employers, that they have to have a certain amount that they offer to their employees. We'll also set up New York State, or whatever state you're in, exchanges so people can buy directly from the state. Complicated as it is, the Affordable Care Act has 2 main considerations, or 2 main penalties. Part A is the big penalty. Part A is you need to offer, if you have more than 50 FTEs, full-time equivalents, you must offer a program that is qualified to meet the Affordable Care Act. Part B is, if someone chooses to go directly to the exchange or state exchange, that you will look to reimburse the state for the cost of that program, all right, as an employer. This satisfies Part A. Part B applies to everybody. You could be Bank of America and you'll have an employee who still goes to the state. Bank of America still has to work with the state on that. So this satisfies Part A of the Affordable Care Act. Okay, let's go back. So we talked about the major medical, what we used to have, and we weren't satisfying the Affordable Care Act. Here with the major medical healthy plus Healthy Advantage, we had 2 staff who stayed on major medical, all right, with high deductible programs. Candidly, I'm one of them. And we had offered to everybody. So I offered to all of my 53 employees, I offered Healthy Advantage. Of those 53, 20 decided to take Healthy Advantage, no deductible program. Okay. We're now, this here is, I'm just doing this for ease at this point, but 10 of them took the basic plan, which was $45 a month. Their premium for that employee was $540 a year. Remember, compared to that $22.44. The other ones who took the ultimate plan, the very high-end plan, 10 of them was still $120 a month or $1,440 a year, still almost half of what it would have been to be on major medical. The employer premium for major medical, still have to pay for major medical, so paying $4,488. That's the same math as we did up here. So this math over here is $4,000 for major medical, but for all the employees that are on Healthy Advantage, it was $6,000. But this also includes, for the Healthy Advantage, the benefit enrollment, the management, and the payroll processing. So the total cost of this program is $13,488, yet we're covering 22 staff members, and 2 of them are still being covered by major medical. Okay, so that is a significant difference. So we have another question, and let me take a moment to read this. I'll read it out loud. I'll see if I can answer it. My schools currently does not offer any type of health insurance, and we have lost out on quality staff due to it. To make it sound even better to my owners, is it possible to have the staff pay a portion of the employer cost as well? This may be very illegal, so please excuse my ignorance. So Jasmine, you're not saying anything illegal. You're saying something that's very rational. However, there's a reason they're called minimum employee contribution plans, that the state does request that does get paid for. So in that circumstance, I would encourage you to learn more, to try to bring your employer to learn more about it. But I cannot say that we would be able to do it. At this time, I don't believe we could do it, but we can honestly help best represent it to your employer so they can see the business case. All right. And so what we have is, how can you be on a major medical and Inspire 360? We cannot get a quote for major medical. You will not be able to get a quote for major medical from us. You can get a major medical quote from your local broker. That's not a problem. And we can still offer you Healthy Advantage. So you can have both. The only difference is if you, and this is, we're getting into the weeds here, but if you take a major medical program and you take a program that has a high deductible program, if you took a Healthy Advantage program and paired them together and actually took both programs, which could be done, you know, maybe a spouse at home has a major medical with high deductible and person working wants Healthy Advantage. Either way, you wouldn't be able to have an HSA program, a health savings account, because you wouldn't meet the requirements of a high deductible program only. But that would be getting in the weeds a little bit. So let me move forward because we are near the end of our time. Again, comparing the costs here are substantially different. And the deductibles, there are none. So an employee choose to enroll in one or more of these plans. Employers only pay for the employees who enroll in the medical plan, so you're not paying for everybody, only who they pay for. If an employee is currently enrolled in a traditional medical plan, it's important to really know too, we're not trying to talk anybody out of being out of major medical. It is critical that if you are in a major medical program for any of your employees and they're like, this program works for me, we do not want to try to talk anybody out of that. They need to be in the healthcare plan that suits them best. With that said, you may be looking as an employer to convert over some going, hey, we've offered major medical, people aren't taking it, they're not using it, I want to give them something that's different. That's where you work with us and our insurance entity, USI, and they'll help design a plan that really works to meet and satisfy all your needs with Healthy Advantage. So working together, again, we work to understand what makes sense for you for major medical as to where you can add Healthy Advantage in or have Healthy Advantage as your primary. So we're going to talk about benefit administration now. Local enrollment consultant. Right now they do it virtually, but because of lockdowns letting up, they're going to be able to do it local again. But this is where they come in and they have a meeting with your staff. They walk your staff through all the different options. They talk to them about the different prices, the different price options, all the existing programs, what might work best for them. They do a once a year checkup. They're the ones who actually sign up the employee if they want to do it. They're the ones who gather all the information, get it over to the insurance company, get the programs all set up the payroll stream, and make it a paperless environment for you. So they're available throughout the year to your employees to answer any questions. In addition to that, your employees and anybody who takes advantage of it get Employee Navigator. It's an online tool that's available by your smartphone device. This allows employees to look up their benefits, to view their options, to take a look at anything they need, to get in contact with their liaison. And it also helps with the payroll integration and participation reports that give you those kind of key reports back to ownership. What we have is we have a program to see if your staff is interested. We've created a small learning module that really talks about what's the difference between Healthy Advantage, major medical, and the voluntary programs we talked about, like the maternity and the dental and the vision. It educates you on the different types of programs, the extended kind of coverage, and what is the difference and what you should do. We've really taken a very fair look at this. We do not, again, want to try to sway anybody into any program that is not a perfect fit for them, but we do want to show an option and we want to educate. So this is available through talking with us and talking through Jen. So please make a request in the chat if you're interested in getting access to this. Okay, oops, I actually launched it and I didn't want to launch the program right now, but it is connected here. So let me go back to the presentation to finish it off. Bear with me a second. There we go. All right. And again, what are the differentiators in this program? It's built specifically for the ECE and the childcare employee space. It's a flexible plan option. So we have where we can hopefully meet everybody's needs, negotiated national pricing for you, unmatched benefit administration, and hopefully you see Inspired Care 360 as a trusted partner, as that's what we're looking to do to any and all of our members. So what would be next, if you are interested, is to schedule a one-on-one virtual meeting with ECE 360 to go through a deep dive, to walk through the implementation timelines and learn more about the financial elements of this program. Most everything we laid out here is everything you will see, but if there are any nuances, any kind of questions, we definitely look to get through that. It does take about a month and a half from the time you say, yes, I want to move forward, to the time you actually roll it out to your staff. It's about a month and a half. Right now, we've had a tremendous amount of interest and we're closer to 2.5 months for rollout right now. So we're having a tremendous amount of interest. We're very happy about that, but we also want to make sure everybody's being served correctly, they're being served right, and none of it's being rushed. Okay, and so with that, one last question. Does the portal integration with ADP, meaning could they enroll through our ADP benefit portal? They can't integrate through your benefit portal at ADP, but it does connect directly with ADP, Paylocity, Paycor, a number of other providers, not all of them, but it does connect and payroll gets sent directly through it to a company like ADP, so it's all electronic. So with that said, and we are at the conclusion of our time, I want to thank everybody tremendously for your time on our Learn More series. If you have any desire to reach out to myself, there's my email address. You're also, through the chat, you're able to reach out to our team and say, hey, give me a call. We'd be more than happy to do that. I want to thank you all very much for attending our Learn More series on ECE 360 ECE Healthy Advantage. I'd like to thank you very much. I look forward to seeing you on the next one. Have a wonderful day. Take care, everybody.